This is a series of vignettes presented by the Pacific AIDS Education and Training Center, which role models the interaction between an oral health provider and an HIV-positive or at-risk patient. These scenes depict opportunities to engage in HIV risk assessment and prevention. Oral sex vignette. This is an 18-year-old female. Learning objectives. Exhibit skills in communicating with patients about sexual risk. List 4 sexually transmitted infections transmitted through oral sex.
Hi Emma, it's good to see you again. I understand you have a few questions you wanted to ask me. What's up?
Yeah, it's kind of personal. My boyfriend and I have been planning on messing around, and he wanted me to make sure that my mouth is really clean so that I don't give him any diseases.
Oh, okay. I'm really glad that you feel comfortable discussing this with me. There are a few things we have to discuss. First of all, it's definitely possible to pass on diseases through the mouth. Things like cold or flu. You could pass on the herpes virus that causes cold sore or fever blisters. You can also pass on sexually transmitted diseases if you have unprotected sex. Let's say if you had bleeding gums or a sore in your mouth from syphilis, you could pass it on to your partner. But the more likely scenario would be that if he had a sexually transmitted disease, he could pass it on to you. Those are diseases like HIV, syphilis, gonorrhea, sexual warts, or genital herpes.
So I could get a disease from him?
Yes, it works both ways. So the only way to make sure that you're reducing your risk is to have protected sex and wear condoms, even for oral sex.
Oh, you don't want to wear one.
Well, he wanted a clean bill of health from you, and I think you can expect the same from him. Why don't you discuss with him the kind of diseases that can be passed on through having sex, especially oral sex, and discuss with him use of condoms. Did you know that now they have flavored condoms for oral sex?
That's embarrassing. I guess I never thought about all those diseases, I'm kind of grossed out.
Well, don't be. You have to understand that, having sex is never free of risk. The only way to eliminate all the risk is abstinence. But wearing condoms reduces your risk, so it's always a good idea when you are thinking about having sex to always use protection every time.
Okay. Well, I guess I have a lot to think about, but thank you so much for talking to me.
Sure, I'm so glad that you feel comfortable talking about this with me. I also have one more tip for you. If you want to keep your mouth healthy, make sure you brush and floss every day.
Okay.
Are you able to talk to your patients about oral sex?